Good morning. How are you today?
I'm very good. How are you?
Great. So what brings you in this morning?
I have had a rhinoplasty done about 6 months ago, and I'm here for my checkup.
6 months ago. How did it go? How was the surgery?
It was super easy. Both my doctors were really great. I had a deviated septum fixed, and then I had my nose straightened and my little bump taken out.
And how were you? Had you been thinking about having the surgery for a while?
Probably my whole life once I noticed it was crooked. So probably about 30 years plus, I was thinking about it when I noticed it in pictures that it was crooked.
And what finally made you decide to go through with the process?
As I was getting older, my breathing was not so great out of one side of my nose. So I started going to an ENT, and they said my septum was deviated. And basically I was like, can you straighten my nose while you're in there? And they said, no, you have to go to a plastic surgeon for that. And so they referred me to you guys, and everybody made me really comfortable, and they did it as a team.
And so you had gone to another consult but didn't feel like it was a good fit. So this seemed to be a good fit because of...
Yeah, when I was in my 20s, I went for a consultation to get my nose straightened to see what that was like, and he basically wanted to give me a whole different nose, I guess small, whatever his view of my nose should be.
Yeah.
And when I came here, I was told, you know, you have a nice nose, we'll just make it straight, you want to look like you,
Right.
because I am ethnic, so I don't want to look like somebody else. So that made me really comfortable that I knew that I was still going to look like myself, just a straighter version of it.
Okay, great. That's a good fit with the doctor.
Yeah, I felt comfortable. No anxiety, no... I didn't even think twice. I said yes the same day.
And how was your recovery? How was the discomfort level? How was the recovery process?
For me, the recovery process was super easy. I was back at work in, I think, 2 days, but I work from home. So I was out from my bed to working within 2 days, but I didn't have any problems. I basically took, I think, 3 painkillers the whole time, and that was really just first day.
Wow.
And I don't even actually think I needed them. And other than that, I didn't have any problems. I wasn't really swollen. I could still actually breathe with, I guess there's stents in there. I could still breathe better than I did prior to surgery, so that was cool. But
How was the sleeping? Did you sleep okay?
I was sleeping fine. I just put an extra pillow, and
Kept elevated.
it was remarkably, you would think that it would hurt. It does not hurt.
Okay, great.
Shocking. True.
And so it sounds like you'd do it again if you.
Oh, I would do it
if you had
100 times
right,
again.
right,
It was the best move I ever made. This is probably what my nose should have looked like, pending whatever happened to it. But yeah, it was a really good move. I can breathe. I don't snore anymore, which is cool. I can walk without getting winded because now I'm not breathing out of my mouth all the time. I can just breathe. So it has changed my life. I look at myself differently in the mirror. I don't think about my nose anymore because I used to think about it all the time. With pictures and things like that, I used to just get nervous and, you know, not want to take a picture because I was like, oh God, my hook is going to show.
So
Yeah.
what would you say to somebody considering rhinoplasty and septoplasty?
I would think do it if you don't want to look like a different person. If you want to, you know, just make a little bit of an upgrade to whatever might have happened in your life, fine. But main thing, like, if your doctor makes you feel comfortable and you don't have any anxiety, or, you know, you don't get that something's wrong here, it's a good fit. That's what happened with me.
Good. Beautiful.